Hello everyone, welcome to my 9-month progress report. My PhD thesis is microbiome modulation in chronic inflammatory skin diseases. My name is Gabriella Mohos. I'm a medical doctor and a PhD student at the Department of Dermatology, Semmelweis University, and our vision is to provide a better care for patients with chronic inflammatory skin diseases with a mission and implementation of microbiome modulation in chronic inflammatory skin diseases. So I have two ongoing projects. The first is about the microbiome modulation, and the second is about the topical calcineurin inhibitors. Let me start with my first project, which is investigating the effect and safety of microbiome modulation in atopic dermatitis patients. Atopic dermatitis is a chronic inflammatory skin condition with itchy, red, dry, and irritated skin, and most commonly known as eczema. In the children population, it is the most common skin diseases, with affecting 20% of children and 3% in adults. It has a decrease in quality of life, including physical, emotional, and social impact. And with severe atopic dermatitis, patients experience quality of life impairments and experiencing depression. More than 20% report suicidal thoughts. Meanwhile, the gold standard treatments are moisturizer, topical steroids, and immunosuppressants. They sometimes not enough or comes with side effects like skin atrophy or an increased risk of infection. So further studies suggest that microbiome has a major impact on atopic dermatitis. So modulating the microbiome would be a novel, effective treatment option. So our aim is to evaluate the efficacy and safety of microbiome modulation in atopic dermatitis. And our question is microbiome modulation effective and safe in the treatment of atopic dermatitis? To answer this question, we have the PICO framework. P represents the AD patient with a microbiome modulation intervention, including the probiotics, the prebiotics, the symbiotics, or the postbiotics and antibiotics, compared to placebo or the standard treatment, with a primary outcome of the disease activity with the SCORAD or the EASI, and the secondary outcome, the quality of life. We hypothesize that microbiome modulation is effective and safe in the treatment of atopic dermatitis. And if that's true, then AD patient would have a better quality of life and a controlled disease activity. And we could offer a safer and novel treatment option. With my search key, I use the first domain as the disease, and for my second domain, for the microbiome modulation. With this search key, I had almost 12,000 results, and after the selection phases, then it ended up 106 eligible articles. And I have a preliminary result and the figures which I like to present. So in my first preliminary figure, you can see the change in the SCORAD scores in patients treated with probiotics compared to placebo in an 8 weeks of intervention. And the outcome is the SCORAD. SCORAD is scoring atopic dermatitis to assess the severity of the disease. And it has a range between 0 and 103. And the higher is the score, the more severe the disease. The lower the score, then it shows clinical improvement. And in this figure, there are 14 RCTs in total of 1,000 patients with atopic dermatitis and with moderate heterogeneity, which is 69%. Which can due to the differences in ages or different types of probiotic products or the dosage. And the outcome we expressed as the mean difference in SCORAD score change, and the pooled mean difference is -4.6, which is with a 95% of confidence interval, which is statistically and clinically significant. And it can show that probiotics, so it favors the probiotics group, and it means that it can be an effective adjunctive treatment for patients with atopic dermatitis. We investigated here only the placebo groups, so further analyses are needed for the standard treatment. Here you can see my progress of my first project. We finished with the risk of bias assessment and currently analyzing more figures and tables. Moving on to my second project, which is investigating the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases with an international survey. So immune-mediated skin diseases like AD or psoriasis, vitiligo. As I mentioned, AD is a chronic inflammatory skin condition with itching, and the first-line treatment are corticosteroids, but it has come with side effects like skin atrophy and infection, but it's most widely used. More than 90% of the patients using corticosteroids. So immunosuppressants like calcineurin inhibitors are the second-line treatment of the atopic dermatitis. Only 10% of the patients using this. It has two main active ingredients with tacrolimus and pimecrolimus, and mostly used as an off-label therapy. Also, it has some benefits like not causing atrophy, and you can use on sensitive areas like on the eyelids. They come with challenges with the photosensitivity and compliance issues, like it has a theoretical increased risk of skin cancer. So that's why the effectiveness needs to be explored. That's why our aim is to evaluate the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases. The question is, are calcineurin inhibitors effective and safe in the treatment of immune-mediated skin conditions? To answer this question, we have the PEO framework. PRE represents the immune-mediated skin condition patient using topical calcineurin inhibitors with the primary outcome of the changes of the disease activity, and the secondary outcome is the adverse events or the compliance. So we hypothesize that calcineurin inhibitors are effective and safe in the treatment of immune-mediated skin condition. And if that's true, then we can implement in the clinical field, and a patient can extensively use calcineurin inhibitors in immune-mediated skin diseases. So we will collect data from the experts and from the patients, asking them about the treatment effectiveness, the satisfaction of the outcome, the treatment duration, the frequency of follow-up, and from the patient about the compliance assessment, the side effects and management, and the prescribing of the severity level. So in summary, I would like to submit my first project this year, September, and my next project, May 2026. I would like to end my presentation with a quote from Lao Tzu: "The journey of 1,000 miles begins with one step." Thank you for your kind attention.
Regarding the first project, I would like to ask that, in your opinion and based on the articles that you reviewed, how much time does it take for probiotics to take any effect?
Thank you for your question. As I reviewed the articles, in the articles, they usually took the probiotics 4 weeks or 8 weeks, but there was a follow-up time at the 12th or the 14th week, and we will do subgroup analysis about the follow-up time, so which duration of the treatment would be the most effective length of duration.
Thank you. And my other question would be, where do you see the place of antibiotics in atopic dermatitis?
Thank you for your question. Antibiotics, I found only one article which present antibiotics, but it was we couldn't use for the analysis in antibiotics because in most articles, antibiotics only used as a secondary infection treatment, not for atopic dermatitis treatment.
The second topic, calcineurin inhibitors in dermatology, they are on-label treatment for atopic dermatitis. What do you think? Why is it not often used? You said it's under 10% and they seem safer than corticosteroids. What do you think? Why don't we, dermatologists, doctors, prescribe them?
Thank you for your question. So there is a fear of using calcineurin inhibitors because there is a theoretical increased risk of the skin cancer, and I think there is no enough data to prove that it is not causing any possible skin cancer. So with this survey, we would like to collect data from this too.
To your knowledge, what kind of skin cancers does it cause? Or what's the fear?
Thank you for your question. I have not analyzed this, what skin cancer would be represents with the calcineurin inhibitors yet.
Rather associated to lymphomas. The fear is rather to lymphomas, not so much the typical types of skin cancer, but thank you.
Thank you.
I was wondering, because the microbiome modulation is a hot topic in medicine in general, are there any probiotics that were frequently used, or is in most of the studies there are used different types of products?
Thank you for your question. There were some articles that present different type of products, for example, this BioGuy or the ProBio 65, but these are a mixture of probiotics. Sometimes in other articles they were only use one specific bacteria, but usually it is a mixture of this.
And do you plan to do a subgroup analysis based on that?
Based on the bacteria, no, because there are other subgroup analyses planned for this. For example, when only use probiotics, or a mixture of probiotics and prebiotics would be synbiotics, or the postbiotics. This is the plan.
You said with your hypothesis that the microbiome modulators are effective and safe.
Yes.
Okay. Did you investigate safety outcomes?
Yeah. I mean, the secondary outcome was the adverse events, and they reported...
Were there any?
There were some gastrointestinal issues, but with probiotics, they were well tolerated, and there wasn't so much adverse events, only this bloating or nausea, but they reported also in the placebo group too.
Okay.
So, yeah.